for Medicare beneficiaries, in terms of Medicare dollars spent per beneficiary, the Rio Grande Valley, #1 in the whole country. How's that possible? Right? Well, I kind of found out how that happens. And the way it was happening is, we don't, and I'm sure you know that we're pretty underserved, and back then it was even more so. We heard, how long does it take to get in to see a neurologist? How long are your appointments with your primary care physician? How long does it take to get an appointment? If you have an urgent issue, how quickly can you get to see them? Or do you end up in the emergency room? And if you end up in the emergency room, what happens from there? So the other thing that happens is in the Valley, and I don't know if it was cultural, but when I was a resident learning from the attending physicians who've been here for a long time, great doctors, right? But what I noticed was missing is how the doctors communicate with patients and their families about their illnesses. How did they educate them? How did they explain to them, here are your options, this is what you need to plan for? How can you do that in 5 minutes? So that was the big missing gap. And the other thing the Valley has is very, very low health literacy. Very low health literacy. There's huge reasons for that. Cameron County is one of the poorest counties in Texas. We have language barriers, right? We're underserved in terms of the patient to physician ratio, and all of that creates this perfect storm for, like I said, if a person has an illness and they're dying and they don't understand it and nobody's communicating, our default in medicine is to prolong life as much as we scientifically can, right? And these days, that's pretty far, but it's pretty rough. And we're not healing a person, we're not restoring health, we're just prolonging life, and there's a huge difference in that. So what I started doing in my practice was communicating with people. And my attendant said, oh, it doesn't matter, people, they want everything done, and nobody listens. That's absolutely false. Here in the Valley, that is false. That is not our culture in the Valley. What was missing is actually the medical culture causing that to happen. Because if it was the patients and their families, then whatever I said shouldn't make a difference. And it made a huge difference. So when I was doing hospital medicine, that was one of the things I would do is communicate with people, explain to people, help them plan, and empower them to make the decisions that are right for them, based on their beliefs, based on what they want for their life. Not for me to tell them, you're gonna get this, you're gonna get that, but to have a physician point out, here's your illness, this is what you can expect, here are your treatment options, here's how to plan for the future, here are the key decisions you need to make before it's too late to make those decisions. And guess what happens? People make decisions, they navigate the illness better, they get the care that they want. What most people want, though, when they're dealing with serious illnesses being, I don't have a cure for it, I have lots of treatments, I don't have a cure. Eventually the illness results in death, right? I can't change that. But how do you want to live during that illness? How do you want to navigate it? That varies widely. Our default in medicine is not what most people want. Most people would say, if I'm dealing with a serious illness, I want to live as comfortably as possible. I want to have as low burden of symptoms. I want to suffer as little as possible. I want to enjoy my life as much as possible. I do not want to go through a bunch of medical treatments that are going to cause pain and suffering and not change the outcome. Our default in medicine, though, especially in the state of Texas, is to do everything possible to prolong life, no matter the pain and suffering that it inflicts, no matter if it works or not. And the only way to change that is for the patient to say what they want. That starts with the doctor asking, what do you want? And that whole conversation. How often do doctors ask you that? Typically not until it's an absolute critical emergency. And then it's not the best time to be talking about this. Usually though, because the patient can't talk if it's that bad. And I'm talking to family members, I'm talking to surrogate decision makers. So to bring that back to dementia, do you know how many types of dementia there are? You know, there's about four kinds. I'll tell you a little bit about it. So Alzheimer's dementia is the classic prototype. Slowly progressing, usually starting with short-term memory problems, right? And then progressing over usually many years. And that rate is variable, the age at which it starts is variable, it's typically older. And it follows, you know, barring any other health problems, it follows a pretty steady cadence, progression of symptoms. With the advanced stages, you know, there's 7 stages of Alzheimer's. Stage 6 and 7 start getting into the advanced stages. At stage 6 is where it starts impairing a person's ability to care for themselves. How to get dressed, how to go to the bathroom, remembering to go to the bathroom. And that's the stage where caregiving gets even more and more difficult.